be your nurse today. How are you?
Good, how are you?
Good, thank you. I'm just going to ask you a few questions before we start the physical examination, if that's okay with you.
Yep.
Okay, why are you here today?
Just a routine physical.
Okay, and have you had any past illnesses?
No.
Okay, and have you ever had your blood pressure taken before?
Yes.
Okay, and do you know if your grandparents or parents have any past history of having high blood pressure?
No.
Okay, I'm going to go wash my hands before we start the examination. I'll be right back.
Okay.
I'm going to turn on the water to a comfortable temperature. Make sure you soak your hands really well. I'm going to start from the cleanest part of your hands and work your way to the dirtiest. So you start from your wrists. Make sure you get the back of your hands, as well as the palms. And then get your fingertips, which are the dirtiest part. You let them drip dry so that you don't shake your hands and get more bacteria on them. We don't have paper towel dispensers, so we're going to substitute. Make sure your hands get really dry. And then you come back over to the faucet and shut it off. Hi again. I'm going to take your temperature, height, and weight. I'm going to take your temperature first. So okay. If you could just lift up your tongue and put your tongue down and close your mouth. Beep, beep, beep. Okay, you can lift up. Okay, your temperature was at 98.4, which is the golden standard, and temperature should range from 96.4 to 99.1. Okay, so if you could come over here, I'm going to take your height and weight. If you could step forward onto the scale, I'll take your weight first. And is there a comfortable position that you would like me to start?
100 is fine.
Okay. I'm going to calibrate the scale first. Her weight was 132 pounds. Okay, so if you could step off the scale, I'm going to take your height. If you could just turn around backwards, I'll help you back onto the scale. Go ahead. Okay. Okay, if you could just duck down for me and step off. Okay. Her height was 5'6". Okay, if you could come back over here. I'm going to take her pulse now. Okay. Her pulse was 64, and the range should be between 60 and 100 beats per minute. The elasticity was a spongy feeling of her veins. The rhythm was regular, and her symmetry of her respirations was equal. And I took her respirations after I took her pulse, and her respirations were 12, and the normal range should be from 10 to 20. The patient was in a sitting position. Okay, so now I'm going to take your blood pressure. It's okay with you?
Okay.
Okay. position. The golden standard for blood pressure should be 120/80. The cuff size should be about 40% of her arm. So if you just remember to pull your shirt up just so I can take it. And the cuff placement should be about 2 finger width apart above her brachial artery. Just turn your arm like this, and you can rest it on the table. The patient is in a sitting position. I'm using the diaphragm side of the stethoscope. If you don't mind, I'm just going to clip this to your shirt right here.
All right with me.
Come over here. Her blood pressure was 110/70. And that concludes the examination for today. Do you have any further questions?
No.
Okay, great. Thank you.
Thank you.